My name is Andrew Travers. I am the Provincial Medical Director for Emergency Health Services, and I'm also an emergency physician. So one of the very first things to understand about this is that our current protocols for all patients in the province are really, really good. They're based on evidence and they're updated continually in a special kind of format. And these protocols, despite being very good, don't work for everybody. And an example of that is that there's children and adults that have essentially these conditions which specifically aren't addressed by our specific, precise protocols.
Hello, my name is Helen McTagg, and this is my daughter Robin McTagg, and we are a part of the EHS Special Patient Program. We have the distinction of being the first special patients in Halifax in Nova Scotia. My daughter has a very severe seizure disorder. She doesn't meet the standard protocol for a paramedic arriving on the scene of a seizure patient.
So the main reason why we're doing this is that we want to improve patient outcomes. We want to optimize their care. We want to have a specific, tailored approach for that individual patient, so that when the 911 call starts and the care begins, they have a safe, effective, and seamless and integrated care plan that begins once the paramedics arrive on scene.
I'm Mark Wheatley, an advanced care paramedic, acting regional manager for EHS Central Region. For about the last 10 years, we've had the opportunity to identify this special group of people who fall outside of the normal protocols for paramedics. So what this enables us to do is to deliver the right care to the right patient at the right time. As soon as we identify them as a special patient, we recognize that our normal protocols either don't work on this patient or they're not appropriate for this patient. So we seek the information both off of the card and in consultation with the patient if they're able to speak with us, or with the family members who are also, again, well versed in this program as well.
My name is Gilles and I have been a caregiver and respite care provider for Helen and Robin McTagg for the past 11 years. Knowing that Robin has the special patient card provides a huge level of confidence for myself. When I started working with Robin all those years ago, I had never even seen a seizure. So the fact that here I was working with a child who had life-threatening seizures, knowing that the paramedics knew exactly what to do, that they knew her, and that the staff at the IWK would know exactly what was taking place because of the card when Robin arrived, was a huge comfort to me.
My name is Tanya Fraser. I'm the Special Patient Program Coordinator, and I am the Administrative Assistant to the Provincial Medical Director. The card itself is about the size of a credit card. The front of it has the special patient logo. As well, it has a protocol. Each special patient is designated a protocol number. As well, Dr. Travers, the Provincial Medical Director, his signature will be on the front. On the back of the card, it has the protocols that the paramedics are to follow, the diagnosis, the allergies, where they're to be transferred to.
My name is Gilles Boudreau. I'm a critical care paramedic. I work at Lifelight and on the ground ambulance. And when we arrive on scene and we recognize that it's a special patient, the family members will present us with a special patient ID card. And on the reverse side of the card, it outlines the medical diagnosis and any special condition that we might consider.
That special patient card, when it is presented to the paramedics, there is absolutely no question. They know that this is exactly what has to happen to make sure that Robin receives the best care possible.
So my name is Jen McVeigh, and I'm the Medical Oversight Physician for the Halifax area with EHS Nova Scotia. If dispatch is made aware that this is a member of the special patient population, it primes the system. So as soon as the paramedics are going to the scene, they realize that they're going to a special scenario. They can mentally prepare. They know that this patient is potentially quite sick, so they can expedite the process. And then when they arrive at the hospital, the triage process is smoother and the care is more uniform, so that it's standardized. It's done the same way every time.
My name is Angela Era-Robar. I'm a clinical nurse specialist. I work at the IWK and I work with children with chronic illnesses. I feel that it offers such peace of mind to the patients, to the families, and to the care providers. Everyone is aware of what's going to happen next. There's no need for additional questioning. There's just a lot more calmness in a crisis situation.
So one of the very unique things about this is that we're one of the very few places, if not one of the only places in the world that's actually doing this, where we're connecting with the in-hospital healthcare providers and coming up with a plan that extends all the way back to 911.
When Robin has a seizure, if it has gotten to the point where I'm going to call 911, you make your first 911 call, and they come on and say, 911, what's your emergency? And I say, I need an ambulance right away at 3182 Glendale Road. And then you wait until you're put through to the paramedics.
My name is Bruce Cox. I'm an ICP and a supervisor at the EHS Communication Center. So when the patient themselves or their family member or caregiver calls, they identify themselves to our call takers here at the center as the person being a special patient. From that, we enter a special short code into the system, which then identifies that person as a special patient and fills information out into our system and the paramedics' mobile tablets. The paramedics are told what condition the patient has, what the protocol will be to treat them, and which hospital will be recommended for them to be transported to.
When we arrive on scene, once we're presented with the special patient card, we'll turn it on the back side. There's some information there regarding diagnosis and special treatment that we can provide. En route to the hospital, we'll notify the receiving hospital that we've identified a special patient.
So when the paramedics are en route with the patient, they do call ahead to let the emergency room know how long it'll be until they get there, who's with them, and to let them know that they have a special patient protocol. At that point, one of the emerg nurses will go to the binders, pull out the patient-specific protocol, and there may be more details behind the EHS card that directs them in their care. And once they arrive, there's a report given, a handover given, and the card is returned to the family.
But if we know some of these special patient care needs at the very first point of the 911 call, there's this chain of survival that can be built. Now, not everyone has the exact same chain of survival. These patients may have a very specific set of things required.
My name's Ken Stevens. I live in Dartmouth, here in Nova Scotia, and I am a special patient. My doctor and my VAD coordinator had mentioned it to me, and that maybe we should all become a part of this program. I had a heart attack a number of years ago, and I was surviving with that, but then my heart started to severely deteriorate, and I went to the hospital, and there's not much they could do with me, and there was no transplants available, so they put in what's called an LVAD, which is a left ventricle assist device. It's a mechanical pump basically in my chest. And that's what's keeping me alive, and that's bridging me to the point where a heart becomes available.
So the potential threat to these patients, if we didn't know about them, didn't know where they were within the province, and they collapsed out in the community and we weren't aware of them, then our paramedics could arrive on scene and specifically do the wrong thing for the patient.
Check for a pulse, for instance, and I have no pulse. Chest compressions, which is basically, it's not a good idea because I got a mechanical pump in here and they'll crush it. So there's certain, procedures that they would have to follow.
That's the beauty of this program, is that once the patient is identified by this card, all of the information is in fact found on the back of it. So where we would normally have to educate on a change of protocol 1,000 paramedics, in this case this is the change of protocol, and it gets the education takes place at the time, at the ambulance call, and the paramedics are well versed in the program. So because we have so many patients enrolled in this and each one has individual needs, this negates the need for us to have individual training on each of those patients to 1,000 paramedics. So not only is it a good program, but it's a time saver for us as well.
I think it's the intangible outcome measures though which make a difference. And it's those things where, again, even before the phone call, when the paramedics are delivering the card to the patient's family, that there's something there about a connection being made, a chance for the patient, the family, to see an ambulance, to see a card, to see a bit of a plan, and just saying, look, we're here in case you need us. You can't evaluate that, but I think that's the kind of thing which does give some benefit.
We want to ensure that not only is the patient aware of what the program is about, but those that will be around the patient and perhaps will be the people to call 911 are aware of what the protocols do and how they protect the patient.
It gives me reassurance that, and my family especially, that the paramedics are up and knowledgeable of my situation.
I find that the cards are a voice, and they can be the voice for the patient and the family when they just can't find the words. They have to hand over a card and the information is there.
EHS has always been a forward-thinking section of the Department of Health. We've done a number of things that's quite innovative in terms of providing care, from pre-hospital care of heart attack patients in Cape Breton to the community paramedicine project within certain parts of the province. And the special patient program is an example of that innovative thinking in terms of trying to move what usually takes place in the hospital to the pre-hospital world or pre-hospital environment.
To apply for the special patient program, we require an application to be filled out, and we would like the attending physician or the specialist or the specialist to fill out the application and send it to us at EHS for Dr. Travers to review. This application can be found on the EHS website and clicking on the Provincial Medical Director section. We are more than happy to accept phone calls, emails or faxes from anyone within the province who has questions or concerns about the program, or maybe even changes to the card that is required.
It means that she can go anywhere with anybody with this card, and all you have to know is two numbers really, one because one repeats 911, and we have the finest paramedics at our service.